as we run a small business, we see some of the new rules that are coming with the healthcare reform and just the everyday decrease in reimbursements that we have. It's becoming more difficult to run a small business. And it's definitely more difficult hiring more people at this stage because of all the rules and decreased reimbursements. We're going to discuss this in two parts. One, some local issues, like in New Jersey, and then obviously nationwide new healthcare reform.
So maybe I could just start off by saying one of my reasons for running for office, having never run for politics before in my life, is that I think our government has become detached from the issues of the real world, how businesses operate, how they survive, what it takes to create jobs. And particularly in this healthcare bill, I think our legislators, in their wisdom, forgot that you're not just medical practitioners. You are businessmen. You need to pay jobs. You need to support jobs. You need to have revenues that exceed your expenses. And if you do not, then you don't survive. And to me, it was the height of arrogance to pass this bill as it was constructed in the dead of night through political dealing, through back-scratching and long rolling and trade-offs that nobody really knows what kind of deals were made, to transform America's medical industry by the act of a single piece of legislation. Not to attack the problems in sort of scalable terms, but to think that we could divine some great plan to fix medicine in America. And I think people are now waking up to the fact, as we begin to think through the ramifications of this, we're not going to control costs, we're not going to increase access, and we're not going to improve quality. In fact, we're probably going to do the reverse of all three of those. So why did we pass the bill?
I think we agree. And as a small business, you know, I look at it frequently. Do we need healthcare reform, redoing our whole healthcare system, or do we need healthcare insurance reform, where maybe getting insurance across state lines, maybe having redoing the Medicare payment schedule, where maybe the government would pay a certain amount for Medicare, and then you and the patient can decide on what fees are appropriate, rather than someone telling us this is what we must take.
So I think one of the confusions about this debate is that people confuse the issue of the supply and demand of healthcare with the issue of how we finance healthcare. Those are really two separate issues, okay? In terms of the supply and demand for healthcare, the core problem in America is that over 80% of the healthcare is consumed by people who don't pay for it. In other words, it's the insurer, the government, or your employer that pay for your health care. You don't have skin in the game. A much better plan would be to empower individuals to control their own health care dollars through tax deductions, not through the employers, but which they get themselves, which makes them a smart shopper for health care, so that we wouldn't consume without any sense for what it is we're buying.
Totally agree.
So the second issue is how we finance health care, okay? Insurance, in its purest form, is supposed to be for that large expense that you can't pay for yourself. We've changed insurance in America to the concept of first dollar coverage. A much better plan would be, the one reform, the one innovation in healthcare financing that really works is health savings accounts. Create a tax-deductible, tax-deferred personal savings account that people could start at a very young age to build up a bank of dollars, almost like a checking account, to pay for their ordinary expenses. They would own it. The government wouldn't own it. It would create tremendous individual security, especially as people age. The other thing, over multiple generations, it would create trillions of dollars of investable capital, which could funnel into the economy to finance businesses. You combine that with a much more dynamic, flexible, multi-state insurance business where people could buy the insurance policy they want, not the one dictated by the government, but the plan that they want. It would typically be a higher deductible plan where they would have more skin in the game. They would pay for the ordinary expenses through their HSA. That way we would have smart financing, smart consumption, and we would have fair reimbursement for the providers of health care who need to run a business.
And I think that's a great idea, but let's look at another angle. New Jersey has 400,000 illegal aliens.
Okay.
And obviously, that's tremendous consumption of medical care. So when we have our own savings accounts, which I agree with, how then do we finance, or what do we do about all these people that are going to be on the healthcare roll, whether they come to the emergency room or the hospital when they're really ill? How do we either get them in the system, or what do we do with this immigration problem, to try and stop this from getting any worse?
So I would say there's two issues here. One has to do with the broad issue of the cost of illegal aliens to the economy at large. They're straining our social services, not just the hospitals, but the schools and many other aspects. So my plan is to enforce our borders and to remove the incentives for employers to bring illegal aliens here. So we have to stop that at its source to be able to address the problem. The issue of how it affects the medical industry is we need to start being more honest about the direct cost of treating illegals. Instead of just blending it into the overall cost that we all pay for health care, let's make it more transparent. Let's not just make it a risk transfer, or a price transfer, or a cost transfer to everybody else, but maybe we should treat these patients in separate clinics, okay, which are staffed by interns, nurse practitioners, fewer doctors, a different avenue for the treatment of patients who can't pay or are here illegally. Obviously, we have a moral obligation to treat every patient in need, but we don't need to bankrupt the system in order to do that. But I think it begins with honesty. Let's just be honest about what the cost of this is. Now, what's the most effective and most efficient way to treat them?
Yeah, Joe, will tell you about a story.
We have a problem with serial users of our health care that are here illegally. I had a patient earlier this week that 6 months ago had a child here, so she had prenatal care. She had been birthing the child for free. Now the child's having postnatal care, well baby care. She's having the same care. She comes now to the clinic and she has a bad gallbladder. She shows up in the hospital the other night. She has maybe a bile duct stone. She has all sophisticated testing, which costs a phenomenal amount of money. We finally take her to the operating room, take her gallbladder out, and she goes on. Now she's probably ready for her next child. My feeling is that we should take care of people in their time of need, and once their critical time is over with, say, now you no longer are going to be taken care of on our largesse, and it's time for you to go back to where you came from. And now you're recorded here. If we find that you're still in the country after a certain period of time. Problem is, though, the anchor babies. I mean, how do we deal with the anchor babies and with these serial abusers of our generosity?
It's a significant issue. Again, I think you need to stop illegal immigration at its source, because otherwise you're just going to have a constant stream of patients who are taxing the system, like the patient that you described. The other thing we need to be very honest about is that when the system runs out of money, as we are doing now, you have to ration care. So the question is, whose care should be rationed? Should it be the senior, the person who paid into the system, the American citizen who's truly in need, or should we ration the care of the person who is here illegal? Let's just be honest about the question. What's the answer to the question? If the question is that all Americans agree that when we run out of money, we should ration the care of the illegal as opposed to the U.S. citizen, then let's ask the question, what does that mean? How do we ration that care? How do we do it in a way that still fulfills our moral obligation to treat a patient in need without taking money away from a truly needy American citizen?
Hasn't that decision been made for us? Since they took $500 billion away from the Medicare budget,
Right.
And if you speak to our seniors here that come to the office, they're all very nervous because, there's a lot of this end-of-life care that people discuss. Mm-hmm. And are we now going to be taking money away from, in quotes, end-of-life care for these seniors? Whether they fracture is there going to be a difference if someone fractures a hip at the age of 68 or someone fractures a hip at the age of 89? And how's that going to be treated differently? These are their concerns. So when you take $500 billion away from the Medicare budget and tell them that their services are not going to be decreased, and that you're not going to ration care, I think someone has to be honest with these seniors.
It strains credulity, but I will tell you that as I talk to the seniors, they understand that this bill, they are beginning to understand that this bill fundamentally changes medicine in America. It puts the Secretary of the Health and Human Services between the doctor and the patient. And what the Secretary shall determine at a future date in terms of the kind of health insurance you can buy and what are the policies for approved procedures and what are the reimbursement rates, extraordinary transfer of power to an unelected bureaucrat. And I think people see this not only affecting their health care, but their liberty, their ability to make individual choices. And you're right, we haven't been honest about the money either. We took that $500 billion not to solidify the system, but to push it into other entitlements for health care service.
As we were talking about just 10 seconds ago.
You know, you touched on something, and we've spoken in the past about it, the unfunded mandates that go along with this and how things that are being done in Washington are affecting us here, and you're really our local representative and really looking out for the benefit of the taxpayers of New Jersey and of the 12th District. And half of this bill is really unfunded and going to go back on the states.
Right.
How are we going to really shed the burden of the federal government and let the states do things cheaper and more efficiently at a local level?
The problem is that the way the healthcare systems are run, both by the states and the federal government, we discourage innovation. We discourage a free marketplace. We discourage innovation and diversity of services. The more the government controls the healthcare dollars and the more they mandate which solutions they want, the more money they drive out of the system, both because you as doctors are not willing to invest in your practice, innovators in the life sciences business, the medical products business, the device business, they see their ability to earn a fair return on their investment going down. So we're destroying the supply of healthcare. At the same time, we're doing nothing to control the demand or the consumption of healthcare. And I say it frequently, but I don't think most people who supported this bill understand macroeconomics 101, which is, supply and demand. Okay, if you decrease supply and increase demand, you either drive price through the roof or you just significantly shrink the quantity of medicine that's available, and that's what's happened here. I think that we need to have a fundamental rethinking of the way we approach this bill. It's not too late. I think that many votes will be cast this election year around the opinion that people have of this health care bill, not only just because of the medical implications, but also because of the societal implications, that we have a government that passes laws and mandates and regulations without any regard for its impact on the real world. And that's why America's economy is ground to a halt, not just in the medical industry, but in so many industries. I was at a restaurant association meeting the other day, and this is a very, very low-margin industry that employs 300,000 workers in the state of New Jersey, and they're all, like you, saying, we're business people, we can't pay our bills. This intrusiveness, this taxation, these mandates, we have to close our doors. And that's not good for job creation and prosperity. So this election is really about two fundamentally different visions for this country. One, which supports free enterprise, personal responsibility, hard work, and earned success. And the other, which is a system of government-controlled corporations where the government picks winners and losers and bureaucratically manages every aspect of our economic and political lives. And that's what this election is all about. That's why I'm running, and I think our message is going to win.